So when someone's turning 65, they have what's called an initial enrollment period.
Yep.
So it's a 7-month window that they have to enroll in Medicare. So it starts 3 months prior to the month they turn 65, the month of, and then 3 months after. So if you are planning to enroll in Medicare at that time, meaning you're not working or covered through an employer group health plan, through your employment or your spouse's, then you want to enroll in Medicare during that window.
This is Jon Ebersole from Medicare Madness. Jon works with some of our clients at Stonehouse, and he has a lot of clients that he works with outside of our company for sure. I've been doing it for a long time, helping a lot of people sort through these stacks really of paperwork and decisions when it comes to enrolling in Medicare, not just the first time, but then year in and year out.
Yeah.
Just taking care of those clients. So Jon, thanks very much for joining us at the Blue Collar Studio.
Yeah, my pleasure. Thank you.
And yes, I'm going to admit on camera that we started this conversation and I didn't have the recording button. I wasn't recording the mic, so I'm eating crow. Hopefully that's covered by Medicare. Anyway, so listen, I had some questions when we talked about doing this. I think you're a source of knowledge when it comes to this. I know folks feel good when they sit down with you and just what you're doing in your profession. I think people are so confused. It is definitely helpful to have somebody that knows what they're doing find the hopefully the best solution for them, not just the year they enroll, but each year, because everything's changing. So With that said, I asked you, I had some like sort of misconceptions. We get asked a bunch of questions. But before we start, you said you had me loaded up for some trivia.
Yeah.
And I might not know these answers still, even though you asked me. So why don't you just share those? I'm going to pretend I know all the answers, but
so
I don't.
I always like doing this just to like have a little fun with it, because Medicare is not always the most fun topic to talk about. But
if you can make Medicare fun, man,
yeah,
let's
do
my
it,
goal. Magician man.
All right. So the first question is, how many people turn 65 every day in the United States?
I actually know this, but I'm not going to steal your thunder. Go ahead.
No, it's 10,000.
It's 10,000 people. So that's just a day.
A day.
Right.
Yeah. So these are all the baby boomers that are turning 65.
Yep.
And this trend started January 1st of 2011, and it's going to go all the way through 2030.
Okay.
So 10,000 people a day for a long time.
That's a lot of people.
That's a lot of people.
There's a lot of burden on that Medicare plan.
Yes.
System. Okay. What's your next one?
Yeah. So that leads us into the next question. How many people are currently enrolled in Medicare?
I forget this already.
It's around 65 million.
65 million.
Yeah.
Out of, we said about
350 million people in the U.S.
Right.
So by the time all the baby boomers turn 65, it's going to be around 80 million people enrolled. So that's quite a good chunk of the U.S. population.
Big percentage. Yeah. So it's going up from here.
Yes.
The burden, the cost.
And
Speaking
the
cost.
So the third question is, how much did the federal government spend on Medicare? And from the latest stats I have are 2020.
And I think I remember this question because we asked if it was 840?
Yeah, $829 billion.
Billion dollars.
Yeah, with a B.
Yeah, so we're pushing up against $1 trillion.
Yeah, and medical inflation each year averages 8 to 10%. So
we're real close.
That'd be a nice return on investments, wouldn't it?
Yeah. Yeah, we're pushing at $1 trillion cost to run.
Yeah,
Medicare.
very quickly.
Okay.
Yeah. So,
and those are 2020 numbers, right?
2020, yeah.
Okay. Well, thanks. I don't know if I'm happy or worse off for knowing that, but it is jarring, and it does make me understand. It makes all of us, I think, sit up a little straighter and say, "Hey, I got to pay attention to this." Right.
Exactly.
So that's usually what we're dealing with here. You know that, Jon. We're dealing with folks that are making a lot of decisions, and sometimes they're enrolling in Medicare very close to when they're retiring. Sometimes it's not till a little bit later, but it's always a stressful event.
Yeah.
Actually, to be honest with you, most people, when we see them say, they literally, their eyes, like this look of surprise comes on their face and they're like, I need to enroll in Medicare. I'll be turning 65, and it's almost like, oh my gosh, how did I turn 65?
It's
I was 40 10 years ago.
It's a cold reality check sometimes. They can't believe they're at that age.
So let's talk some broad things, and then if you see anything that has to do with what our market around here, the folks look like around here, and deal with, and the problems and solutions you're finding for them. So if you want to drill down into any of these things deeper, go ahead. But just real broad, like one of the misconceptions is that Medicare is for old people.
Yeah.
So what are your thoughts on that?
So typically people are going to become eligible at age 65 for Medicare. So you can qualify under age 65, but you have to meet special circumstances.
Yep.
So some of the most common ways are for someone to be on what's called federal Social Security disability. So it typically takes about 6 months when someone applies, if they're approved for that to kick in. And then they're on that for 24 months. And then the 25th month, they automatically become eligible for Medicare, and they're enrolled in original Medicare, which is Part A and Part B.
Okay.
So that's kind of the most common way. The other way is if someone has what's called end-stage renal disease or kidney failure or has a kidney transplant. So they can become eligible for Medicare. There's a 30-month coordination period where they have to wait, and then Medicare automatically becomes effective.
Okay.
So there's some other ways you can qualify, but those are the two most common ways.
Okay.
Under 65.
So that goes back to another question. So I know the answer to this, but I'll just throw it out there. A lot of people think that Medicare is free.
Yes.
Based on the numbers you shared, $820 billion a year. I'm guessing somebody's paying for that.
Yes, absolutely. Nothing is free for sure. There's two parts to original Medicare. So there's Part A, which covers inpatient care. Part B covers outpatient care.
Okay.
So Part A is funded through payroll taxes that people are working and paying taxes in to help pay for Part A. So someone that's enrolled in Medicare does not have to pay for Part A. It's just people that are working and paying taxes through their employer. And then Part B is funded through the federal general fund, as well as there's a monthly premium that enrollees in Medicare have to pay. So right now, the base premium is $164.90. So around $165 a month. That's just your base, just to get into Medicare. If you have income that's over $97,000, if you're single or married filing jointly, it's $194,000. And then they always look back 2 years for that amount. It's your modified adjusted gross income, which on your taxes, if you're trying to figure that out, it's your adjusted gross income with non-taxable interest.
Gotcha.
is added back in.
Okay.
So I don't know if you want that on there.
To get the modified adjusted
the modified adjusted gross income.
Yeah, that's fine. I mean, so you basically they can look at their tax return. They can see that.
Yeah,
line,
the adjusted gross income. I think it's like line 11 or something on their taxes. That gives you a good idea. It changes
every time.
Yeah, true.
Yeah, I want to ask you. You said that 164 is a month.
Yeah, 164.90. So,
how many people that you work with really fall there? Most people probably fall higher, right? Because of things that they're.
Yeah, I mean, it depends.
Maybe
if we're looking at percentages of people that go over that, it's probably only about 10 to 20%.
Okay.
I mean, it's.
So most people are sticking
Most
there?
people are under that amount, so they're paying the base premium.
Okay, great.
So that's just for original Medicare. So then you also have to add in, a Medicare supplement or a prescription drug plan or Medicare Advantage. And those are all additional costs.
I guess that's where my mind goes, because I'm thinking the bottom line healthcare costs, right?
Yeah.
But actually that goes to my next question, which was, does Medicare cover all healthcare costs?
Right. Yeah. So there's a lot of out-of-pocket costs under original Medicare. So just looking at Medicare Part A for inpatient, you walk into the hospital, you're admitted, boom, you owe a $1,600 deductible right off the bat. If you're in there for more than 30 or 60 days, then you owe an additional copay per day. It's $400 a day, and that goes for up to 30 days. And if you're in beyond that, beyond those 90 days, then there's a lifetime reserve of 60 days that you can only use once. And then that's an $800 a day. And so that's just under original Medicare. But a lot of out of pocket. And then for the Part B side, there's a small deductible of $226. And then you would owe 20% coinsurance. And I guess we could define some terms here to make sure people understand what we're talking about. So when I say a copay or copayment, it's a set amount that you're responsible for, and then you don't owe anything beyond that. Coinsurance is a percentage of what that negotiated rate is or the allowable amount. So your out-of-pocket can fluctuate more with the coinsurance. So you have a $10,000 bill, you have a 20% coinsurance, you owe $2,000, where if it's $1 million or, well, 100, then it's $20. So it fluctuates.
Yeah. Hopefully it's not $1 million.
Hopefully not $1 million.
Well, I mean, the only thing positive I would say about what you're saying is I find it hard to be able to stay in a hospital for 30 days. I mean, they're usually kicking you out of there in 30 hours.
Yeah, a day or two if you're lucky.
Yeah. But we just got to be careful, right? Because these costs will come from all different directions. Right. But so speaking of costs from different directions, talk to me about prescription drugs. A lot of folks think that Medicare covers all prescription drugs.
Correct. Well, original Medicare doesn't even cover prescription drugs. So you have to do two things to get your prescription drug coverage. You can buy, they call it a Medicare prescription drug plan. It's a separate, I call them standalone plans. There's 26 different plans that are available. So they range in premium.
26
plans. Just 26. So they range in premium from around $5 all the way up to about $200.
Okay.
So that's one way to get your prescription drug coverage. And you would do that if you stay under original Medicare and buy what's a Medigap or Medicare supplement. If you do the Medicare Advantage plans, that's Part C of Medicare, which combines your medical and prescription all under one package typically. Then they have drug plan that's included. So whatever your premium is for that plan, that's would include your prescription drug coverage.
I feel like Medicare and healthcare, it's like a fun house without the fun.
Yeah.
Like the floor is like moving all the time because your health is changing.
Yes.
And then these plans, what's covered, what drugs are, tier 3, whatever, that changes. And then all of a sudden what you had last year suddenly isn't the best.
Yes. Okay? So it can change from year to year. Yeah. So whether you're on a drug plan or an Advantage, they send out what's called an annual notice of changes every year. And we can talk about, I guess, the annual enrollment period of Medicare. Yeah. Hopefully we're not jumping ahead too
That's all right.
fast here.
Let's table that till we get to the next.
Yeah, let's table
before we get into that, when you sign up for Medicare, let's talk about, and I made a joke about this before, but let's talk about the 3 things that never improve as you get older, which is your dental, your vision, and your hearing.
Yes.
I won't make the same jokes I made last time. But I know those are important, but they're sort of extras according to Medicare. So how does that get handled?
Yeah, original Medicare doesn't provide any coverage for routine or preventive dental, vision, or hearing, even though they're very important to your health. So if you want those extra services provided, you either have to go out and buy, a standalone dental plan or vision plan or something that combines those if you're under original Medicare. If you do the Medicare Advantage plans, they typically provide those extra benefits. So either way, you have to do something additional beyond original Medicare to get that coverage.
Yeah. Okay. Another topic of healthcare is long-term care.
Yes.
And a lot of folks think that Medicare is, I got that. It's covered by Medicare. So talk about that.
Yeah, that's not covered by Medicare either. So long-term care would be defined as you can't do your activities of daily living. You need custodial care in a nursing home, or you have Alzheimer's where you can't take care of yourself. Mm-hmm. So Medicare does not pay anything for that coverage or those services. That's either self-pay or having a long-term care policy.
Okay.
What Medicare does cover is rehabilitation in a short-term rehabilitation in a skilled nursing facility.
Okay.
So you have to be inpatient for at least 3 days. And then when you come out, you need that rehabilitation care. And Medicare will pay for that up to 100 days in a benefit period. So that's the only rehab that Medicare covers, or nursing care that Medicare covers.
I feel, and I'm going off script here, not that we have a script, but there's the empathy in my body that I just hate when clients are usually going through those things. The stress level is high.
Yes.
And it's usually one spouse trying to take care of both of them.
Right.
And they're going through all those restrictions and qualifications that you're talking about. It's just, it's a bit overwhelming.
It's very overwhelming. Absolutely.
So that's why I love folks that do what you do in your profession, because you take a lot of that, at least for enrolling and stuff, you take a lot of that out. And so I think that's important. Anybody that makes folks a little bit, life a little bit easier sometimes.
That's my goal.
Let's talk about, my wife and I just went on a trip outside the country. And so the subject came up, and we have a lot of clients that travel outside the US. And so the question is, are you covered for healthcare issues outside the US in Medicare?
So Medicare does not cover any medical or prescription drug coverage outside of the United States. So you can get that coverage through a couple different ways. One way is if you have a Medicare supplement or Medigap plan. These are the lettered plans. Certain lettered plans will cover emergency care for foreign travel. Now that coverage is limited. So you have a $250 deductible, and then the plan will pay 80% up to $50,000. So you owe 20% of that up through till they've paid out $50,000, and then they're done. They're not paying anything more. If you are in that situation, I mean, the coverage is automatically included. You would pay your costs there, wherever you're incurring those services, bring those receipts back and turn them in to get reimbursed.
Okay.
Now, in that scenario, because you have limited coverage, it can be a good idea to buy extra travel insurance. So that's one of the things that I can help people work through to see if it's an option that's a good idea for them. I use what's called Geo Blue. It's through the Blues. And a couple can buy different levels of coverage for how many days they're traveling for. So you can get about $1 million of coverage for a couple $100 for a couple. So it's
very affordable.
Very affordable.
Does that coverage last for just a 2-week travel period? Or
you set it for however long your trip is.
And that's what
so if you're going for 10 days, you put the dates in that you're going in. I
don't mean to go off script, but I saw, we were snorkeling off a catamaran, and there were some people doing some crazy stuff.
Yes.
I'm not going to be that guy. I wonder if they're covered for Medicare insurance but there were some people that probably should have upped their health insurance.
Well, if we have time for a little sidebar, interesting story. So I had a client.
Yeah, I always do have time.
He went
for
down
stories.
to the Galapagos Islands and had an appendicitis.
Oh, geez.
So, they're in the hospital. It's a concrete structure. And the doctor walks in, hands a list to his wife and goes, "Here, you go buy this stuff." So she went into town buying the bandages,
no way.
And then brought it back. And then they did the surgery.
Gosh. Everything okay?
Everything, it worked out fine. But
wow.
So, you never know what kind of healthcare you're gonna
holy cow. Okay, you struck a nerve with me on that one. Having my appendix taken out when I was like 20.
You don't want to discourage anyone from traveling, but just be aware.
Stuff happens.
Stuff happens.
Stuff happens. We work with a lot of clients, so we hear some stories like that. And it's a small percentage, but still, if it happens to you, it could be
it can be something we take for granted here.
Absolutely. Yeah. So, let's get back onto my questions here. So, do people think that Medicare never changes? Like once I sign up, I enroll, let's say I'm 65, I enroll and I pick the following plans and I'm done. But that's not the case.
That's not the case at all, for sure. So under original Medicare A and B, they're always increasing the out-of-pocket limit typically. So your deductible to go inpatient increases each year, and other costs within Part A and Part B. Now, if you have a Medicare supplement or Medigap plan, those are the lettered plans.
Yep.
Those plans are standardized and they never change. So as the cost increases under original Medicare, those plans will continue to cover whatever their limit is set up to cover. Now they'll increase the premium on your end to make up for that.
That's so nice of them.
Yes. And then the Part D prescription drug plans, they change so much every year. So they can change their formulary. They can change how much your copay is. So this year your drug might be a tier 3. A brand that's preferred. Next year, they might move it to a non-preferred brand. And now your cost goes from $47 copay up to $100 or a co-insurance. So that's one thing that I look at every year for clients is, I make sure I have their updated prescriptions, and then I check all the plans to make sure, they're in the right plan the next year. And then the Advantage plans can change their premium or copays for services. Now, there's an annual enrollment period in the fall, and people get a notice from whatever plan they're in stating, what those changes are going to be for the next year. So they are updated that way, and then I'm always communicating with them as well.
When it comes to enrolling in Medicare, 65. I made this joke before, like on my birthday, am I supposed to come down and cancel my birthday party, come down and sit with Jon and enroll in Medicare? Or do I have you mentioned a window.
Yeah. So when someone's turning 65, they have what's called an initial enrollment period.
Yep.
So it's a 7-month window that they have to enroll in Medicare. So it starts 3 months prior to the month they turn 65, the month of, and then 3 months after. So if you are planning to enroll in Medicare at that time, meaning you're not working or covered through an employer group health plan through your employment or your spouse's, then you want to enroll in Medicare during that window. And when you make the enrollment is when the Medicare actually starts. Mm-hmm. So the timing can be an issue. So if you want your Medicare to start, Medicare always starts the first of the month. And typically it's the first of the month that you turn 65.
Okay.
So if you want that to happen, you have to enroll during those first 3 months. So if your birthday is in April and you're turning 65 and you want it to start April 1st, you can enroll January, February, or March, and then it'll start April 1st.
Okay.
Now, an important thing for people to know is if you're collecting Social Security will actually automatically enroll you into Medicare. You don't have to do anything. But if you're not collecting Social Security, which most people aren't because they're waiting, for their full retirement age, ideally so they can collect more in Social Security. So people actually have to make the enrollment into Medicare, and they do it through Social Security. Okay. So there's an online website that they can fill out an enrollment application there, or they can call in, do it over the phone, or they can schedule an in-person visit for Social Security to enroll them into Medicare.
I know something that we do see a lot is it's very rare that a husband and wife enroll at the same time. Right. So I think you need to be really cautious. That's why I encourage them to talk to somebody like yourself that understands all the nuances between, is that the other spouse who's not enrolling, or is he or she covered by something else? You don't want to throw something, you don't want to eliminate something by accident. Right. And that can happen.
Yeah. And one question I get a lot is, can I postpone my enrollment into Medicare? So if someone's coming up on 65, but they want to work, till their full retirement age, or they want to work a couple more years, build up their, savings, or they just enjoy their job, they don't want to quit.
Yeah. People still do enjoy their job.
Some people do. So in that scenario, what you can do is you're covered by your employer. So their plan is primary. Typically they have to have 20 or more employees. So there's 2 scenarios that people are in of what they should do with their Medicare. So typically, if you're working and have coverage through an employer, you can enroll in Part A of Medicare because there's no charge for that.
Right.
And then you can decline Part B. And then people say, well, if I don't enroll, I'm going to get a penalty. Well, the penalty only applies if you don't have coverage through a group health plan.
Okay.
So as long as you have that coverage, you're covered. There's no penalty. So you can enroll in A, and the benefits of doing that are you get a Medicare ID number, you get the red, white, and blue card.
Yeah, you're in the system.
Yeah, you're in the system. So later down the road, when you want to initiate your enrollment into B, it's a little simpler process. You can do it a little quicker than if you wait. So that's one scenario. The other scenario is someone's working, but they're covered through what's called a high deductible health plan with a health savings account or an HSA. And those plans are regulated by the IRS. So they have different rules.
I'm just going to stop. No conspiracy theory on this one. I'm just going.
So with those plans, you can't have any other health insurance coverage that's not another high deductible plan.
Okay.
So where people really get in trouble is, okay, I'm going to pick up Part A because it's no cost and I need to enroll in Medicare. But by enrolling in Part A, that's now another health plan. So now they're ineligible to have any contributions put into their HSA, either through them or through their employer. So in that scenario, someone would actually not want to do any enrollment into Medicare. You would just let it ride there's no penalty because they're covered through the employer group health plan. So, and there's a whole
fun.
strategy around how to do your enrollment, when to stop making contributions with the HSA.
Yeah.
So since it's kind of a niche for people, I'll just say, if you have questions on that, reach out to me and
sure.
I can walk you through, because Medicare can retroactively enroll you into Part A up to 6 months.
Yep.
So you have to watch how much you're putting into your HSA when you're getting ready to retire.
Yeah.
So,
yeah, I mean, that's probably a good way of saying, maybe an easy way of looking at it is what you do in your role is, it's not like you have three things and somebody by the end of that conversation, you're either getting A, B, or C. It's
right.
It's a combo of all these different opportunities, right?
And everybody's unique.
You really are, especially when it comes to healthcare. More so
right.
than investments. It's healthcare is everybody's different. So, speaking of everybody's different, let's talk about physicians. Everybody assumes that Medicare is like all doctors accept Medicare, but that's not the case, is it?
So there's original Medicare, and then there are the Medicare Advantage plans. Okay, so I would say in general, most physicians, most hospital systems are in the original Medicare system. So, I mean, Medicare, I would say Medicare is one of the largest networks that you could have, but someone could be in original Medicare, but not participate with your particular Medicare Advantage plan.
Okay.
So each doctor can determine which insurance they want to accept. So it's a negotiation between the health insurance carrier and the provider, if they can come to an agreement, whether that provider will participate, because they have to accept what that plan
right.
is paying for each service. So in general, if you're on original Medicare, that's about one of the biggest networks that you can have. If you're on the Advantage plans, that's where you really need to make sure the providers that you want to be able to see are covered in network.
Can you just talk to me? You defined a couple of things with regards to co-pays and co-insurance.
Mm-hmm.
Sit back. Let's take a step back and define the Medicare Advantage plan versus the traditional Medicare.
Yeah, no, that's a good way to go. So you have original Medicare A and B. You have all the out-of-pockets. You don't have prescription drug coverage. So there's two ways that you can go. So you can buy what's called a Medicare Supplement or Medigap plan. These are the lettered plans. And what they do is they come in and they cover the out-of-pocket cost under Part A and Part B. So the lettered plans go from A through N. Some plans have been discontinued.
Right. You run out of letters
at
some point.
So probably the most common one right now is G, as in George. So that plan covers 100% of your out-of-pocket under Medicare A and B, except for the Part B deductible, which is currently $226. So if you buy Plan G, your only out-of-pocket for medical costs that are covered by Medicare would be a $226 deductible.
Okay.
So average price for a plan like that, they are separated by age, gender, and zip code.
Nice.
So they use those factors to determine what the premium is going to be. And every carrier can charge a different premium, even though they're offering the same exact benefits, because those plans are all standardized. So in this area, I would say for a 65-year-old male, you're looking at around, I'd say $130 to $140 a month for Plan G. Female is going to be around $115 to $125. And then some plans will do spousal discounts, so 7 to 14%, if they're both enrolling through the same company. So that's the Medicare supplement to go with original Medicare. Yep. And then you also have to buy the standalone drug plan. So again, $5 to $200 a month for that. So that package of original Medicare, a supplement, and drug is going to be around $300 per person, roughly per month.
Okay.
So that's one way to go.
And then option two is...
And with that, you don't get the dental, vision, and hearing. So now if you want to add that, that's an additional, anywhere from $25 to $50 for a dental plan, $12 to $25 for a vision plan. So those are kind of a la carte.
Sure.
You can add those one, but not the other.
Sure.
There's a lot of different ways to get those.
On the other side is
the other side, you have the Advantage. So this is Part C of Medicare. So C equals A plus B plus D.
Sure, it does.
Makes sense.
This is the new math.
See, they said we always wondered when I would use algebra, and now I use it.
All right, so Advantage plans are...
So they're combining your medical and prescription drug all under one package.
Okay.
So these are very similar to what you may have had through an employer. So they're PPO, meaning you have in and out of network providers. You can typically save money by going in network, but you have the flexibility to go to both. You have HMOs, which are really not that popular anymore, I would say.
Yeah.
HMOs restrict you to just their providers that are in network unless it's an emergency. So all the clients that I work with, probably 99% of them that go with the Advantage are on a PPO plan.
Okay.
So with those products, they have a network. You want to make sure your provider's in network. So just some of the potential downsides, they have pre-authorization for services, which is what they have now through their employer plans. The only places that don't have that pre-auth is with original Medicare and a supplement.
Gotcha.
And then they'll have co-pays or co-insurance each time you go for a service. Now, why people like to go in those plans is they're lower premium. So, we said about $300 for the medical and prescription package with the original Medicare. With an Advantage plan, you always have your Part B premium. So you always have that $165. But then your additional cost can be between like $0 and $25 a month. So you're saving about $1,500 to $2,000 a year in premium when you compare the two options. But then with this, you pay as you go with copays.
Right.
And then you do get those extra benefits. So you get the dental, the vision, the hearing. Plans are putting in money for over-the-counter items now, and free gym membership through Silver Sneakers. So they throw in a lot of extra benefits that you don't get under original Medicare.
Interesting.
So again, it's a very individual decision. Which one is best for each person.
Let me interject an additional question there, which is we have a lot of clients who snowbird.
Yes.
Right. So let's just say Florida, Arizona, wherever, 6 months out of the year.
Yeah.
So if you're doing planned regular, I'm out of the state, out of my home state.
Yeah.
Do you have a preference what you might recommend there?
So
I know every case is different, so let's put that caveat in there.
So just to explain how they work. So the supplement plans, and I don't think I mentioned this when we first started talking about them, they don't have any network restrictions. So as long as your provider's in original Medicare, you can go to that provider. So you don't have any restrictions on your network.
Okay.
So in a snowbird scenario, they have total flexibility. On the Advantage plans, again, they have a network. So if you're going to Florida for 2 weeks or 3 months, it's going to depend on your carrier and the plan you're in. So if you're in a carrier that has a national network, they might have in-network providers available in that area.
Right.
But then the Advantage plans always cover emergency care outside of the network as in-network. So if you have something happen, even if you're in an HMO, you can still go get, you can go to the nearest facility if you have an emergency situation.
Right. So basically everything's an emergency.
Yeah.
Right.
So, in that scenario, either one's going to provide coverage. You're going to have a little more flexibility with the supplement, kind of a general rule of thumb. But, even now, some of the Advantage plans are keeping copays the same, whether you go in or out of network. So that's kind of a new feature that's been starting to be integrated in the last couple of years that I've seen.
Interesting. How about this question? So you're describing sort of two options, right? Sort of a fork in the road. So I'm enrolling in Medicare and I'm going to choose that package deal that you talked about or an Advantage option. Forgive me for being over general.
Yeah, no, that's fair assessment.
Is this a path I have to stay on forever? Are there situations where I can say 3 years later, "Ooh, hey, I think this would be better for me. Can I switch to the other option?"
So there are restrictions of switching. So when someone first turns 65 or the first time they enroll in Part B, if they've delayed, the Medicare supplement plans, you have a 6-month period where you can enroll in any of those plans and there's no medical underwriting or pre-existing condition exclusions. So that's kind of your one-time chance to get into those without having to qualify through your health.
Right.
There are some ways that you can get into those without those health questions outside of that first 6 months, but kind of that's the general rule, is that's your kind of one chance to get in.
Okay.
With the Advantage plans, they never do any medical underwriting. So you can go into those plans, you can change around within all those different plans, and there's probably about 80 different options for the Advantage, depending where you're at. But so you can move around within those, no restrictions. If you want to go from Advantage over to Supplement, that's where you typically have to do the medical underwriting.
Okay.
Now, there are two kind of main scenarios where you wouldn't have to do that. One, if you move out of the service area of your Advantage. So you're enrolled in Geisinger and you move to Florida.
Right.
Well, Geisinger is not an option if you live in Florida.
Right.
So you're out of the service area. Now you can do one of two things. You can enroll in an Advantage plan that's available in your area, or you can buy a supplement plan with no medical underwriting at that point. It's called a guaranteed issue.
Okay.
So the other scenario
Makes
is
sense.
if you're in an Advantage plan and that plan is terminated for whatever reason, then you can buy a Medicare supplement, guaranteed issue, no health questions asked at that point.
Okay.
Yeah.
So there are ways to change it.
There are ways, but yeah, generally, rule of thumb is you have one chance to get into the supplement plans.
Couple more questions, then I'm going to let you go. Because we did this partially twice. So sorry about that. We work, no surprise that most people watching this, we work with a lot of Procter & Gamble retirees.
Yes.
And so I know you're familiar with the plan that they have there. Talk to me about the traditional Medicare plus Medigap versus what's there in their plan.
Yeah.
It's probably never a layup. It's probably, you got to look at everybody on, but
Right,
in general,
again.
can you?
So the P&G retiree plan, when someone goes on Medicare, is a Medicare Advantage plan. Okay. So it's a PPO. So you're going to have co-pays, co-insurance. The latest plan that I saw, I think it was from last year, 2022, is the latest benefit detail that I have. So it's a $250 deductible. And then there's co-pays, and there's a lot of 20% co-insurances throughout.
Yeah.
I did look, like if someone's admitted into the hospital, if they're in for a week, it adds up to about a little over $1,600. And then they have a maximum out of pocket of $2,250. So that's a low max out of pocket when you compare against the average max out of pocket for Advantage plans.
Okay.
But it's set up where you can get there pretty quickly.
Right.
So it's a low max out of pocket, but
high probability
of hitting it. Right. So again, it's, is that the right fit for somebody? If, is their doctor in network? Do they have that money to pay out, when they get it, those services? When we compare that against the original Medicare supplement package, you do Plan G, it's a $226 deductible, and then everything's covered out of, by Medicare and the Medigap.
Yeah.
And then you don't have any network restrictions or pre-authorization requirements.
So I think we touched on when you talked about the difference between the Advantage plan versus the other traditional package with the Medigap. Is there a type of person? I almost want to say, is there a type of person that like certain people fit into this profile? For me, I know typically when I'm talking to somebody and they do a lot of traveling, they're gone half the year from their home state. I typically say, all right, you might be looking over here, but do you have any way of immediately saying you're probably going to go down this route or this route?
Well, when I sit down with someone, I never tell them what they should do. I'll educate them on both options, to where they can make a good decision for themselves. I mean, if you're walking in and, you work out 5 times a week and you're, not too many people do that, but for people that are, I'll just say in generally, someone that's in good health, that wants to save money on premium, those people are typically looking at the Advantage plans, when we go through both options. If someone's coming in and one either, has some pre-existing conditions, some chronic illnesses, or they've had a major health incident in the past, or worried about one in the future, they're leaning more toward the supplements. Or somebody that could be in good health and is just more conservative of, hey, I want to get in this now.
Yeah.
I don't know what could happen down the road.
Yep.
So it's either someone in, dealing with health issues or kind of leaning on the more conservative side that goes toward the supplement. People that are in, good health and want to save the money, pay as they go, lean more toward the advantage.
Yeah.
Yeah.
This is a lot, right? There's a lot to digest here, and we're just scratching the surface. All I know is when folks sit with somebody like yourself, they usually come out just feeling like, it wasn't nearly like I thought.
Try to take a load off.
And more importantly, a lot more confidence and understanding of direction. Like they know where they're going and they understand some of those details. And you're a resource, I would imagine, with what you do. If there's questions throughout the year, they email you, they call you, whatever.
Absolutely.
Is there anything else I'm missing? I might ask you back because I think there's just so much to dig into. But for this conversation, anything I missed?
Well, do you want me to tell you the story of how I got into doing this?
Sure. Yeah, I love stories, man. You don't have to rock. Go ahead. Cool. I almost said rock and roll again.
Let's rock and roll.
My Lord, my daughter's going to kill me. Yeah, tell me the story.
So, I think it's kind of a neat story how I got into this. Yeah. So, I was started out of college. I got into the Commonwealth of Pennsylvania, and it was a human resource management trainee program. So I went around to different departments within the state, doing like labor relations and classification. And I was really interested in benefits. I don't know, I was just kind of wired that way.
Yeah,
like a little more on the financial side.
You're like a unicorn, man.
Yeah. I was like, hey, how can I really like the state, but it didn't take me long to realize like, this might not be the best fit for me for the next 35, 40 years. So how can I set myself up to get out into the private sector? So I was like, benefits is one way. So I started working it was called the Retired Employees Health Program. So it was a program that the state provides health insurance for retirees for life.
Yep.
So if someone qualifies for that, they get health insurance, whenever they retire up until they die. So we had 90,000 people in that program between the retiree and their spouse.
Okay.
So I was in my job about 6 months, and my boss came to me and said, we're changing everything about the Medicare program.
Oh, awesome.
So they hadn't touched it in like 30 years.
Wow.
So it was about $500 million a year cost, and they had it projected to go to $1 billion in the next 10 years. So they were like, we got to do something. So they did this massive overhaul, hadn't touched the program in decades.
Right.
So I had this huge crash course in Medicare. So I'm learning all this stuff about Medicare, and I go home to visit my mom, and she's turning 65.
Oh,
so
perfect.
She has that stack of material on her table like this high. And she's like,
it's crazy.
John, I have no idea what to do.
Yeah.
So I was like, well, I'm learning about Medicare in my job. Let me see if I can do some research and see what I can come up with. So I did looked at a ton of different things, came back to her and said, hey, here's a plan I think could work well for you. And I went through it with her and explained it. We had the rep come in from the company. They, sat with her, did the enrollment, and they left. And she goes, wow, it made sense because you explained it to me first.
Right.
So I was like, oh, that's cool. I'm glad,
Like a translator. Yeah.
So where we were living at the time, there was like a rec services, like community center, and you could offer a class there, if you wanted to do photography and they would advertise it out like in the local community. So I was like, hey, what if I started teaching a class on Medicare just for fun?
Just for fun.
Just for fun.
Said no one ever.
I just said no one ever.
That's
so
great.
I started teaching this class, and people would come up to me after class and be like, hey, we're going to be turning 65 here soon. Could you help us out? And I was like, I don't know, I guess. Like, I don't know how this works.
Sure.
Like, they're like, well, can we pay you? I'm like, I guess, I don't know. Like, so I would help them go through the whole process. And I did that for a couple of people. And then I was trying to, like, the person wanted a specific plan. And I was like, well, that's not one you can just go direct to the company for. So I was calling around to different agencies to send them to. And so thank God I called the right place, and they're like, wait, what are you doing? Like, we want to come talk to you.
Yeah, absolutely. Yeah.
So the guy came out and met with me. He's like, you're doing all this work, you're educating people. He's like, you could be a really good fit. You could, start selling this, be an independent agent. I was like, I had no idea that existed.
Yeah.
So I'm like, yeah, let's do it. So I started doing it just like evenings and weekends. I'd left the state by then and was working in a job where I worked with health insurance cooperatives for municipalities, which is pretty cool.
That is neat.
So what I was learning in that job helped me with Medicare, and what I was learning with Medicare helped me in that job. So it was a really nice fit. So I did that for 6.5 years, working 2 jobs. And then my Medicare business built up to where it was full-time, working crazy hours, trying to, full-time job. And
you're working with a lot of people.
Yeah.
Yeah. You're helping a lot of folks.
I got to the point where I was like, all right, I got to make a decision. So it wasn't that easy.
No, but I'm sure it never is. There's a lot of conversations before your decision.
I went in full-time to my Medicare business and never looked back. So
I love the Medicare Madness name. I think that's very appropriate.
That was just the class, like what I called the class.
Is that right? Yeah.
And then when I started my business, I'm like, wow, I'll just keep that name, I guess. And
so that's a great story. I love that you helped your mom sort through all of her Medicare options to the right choice. I helped my mom get her email on her iPad. So we're both giving, but I think you gave a little bit more in that case. That's a headache for me. So yeah, I think it's amazing when I'm not a blood and guts guy, so I could never be a physician. So I always admire physicians and nurses and things that I can't do. And oddly enough, Medicare is a topic that it's sort of mind numbing to me. And I know it is to most people. So it's to have someone that sits there and says, I love this. I eat it up. That's crazy. And it's great that it's good job security.
Yeah.
It's good.
Yeah. And I enjoy it. So
yeah, I'm sure your mom's proud of you. So listen, you don't mind if I ask you to come back?
Sure. That'd be great.
Okay. And your website is MedicareMadness.com.
That's it.
Jon Ebersole, you've been doing this a long time. We're helping a lot of people. Thanks very much for working with our clients at times and for everybody you're helping. On behalf of all the folks who don't have to make those choices on their own, thank you.
My pleasure.